Okay, I think we should start now. Let me begin by welcoming everyone to this webinar. And thank you very much for participating. Good afternoon, good morning, good afternoon, and good evening, everyone. Let me first introduce our three panelists and our discussant. Dr. Robert Ndamobisi is the evaluation manager in UNICEF Nigeria. He has more than 20 years experience leading countries on their strategic reviews and evidence-based programming. He has served as the Chief of Planning, Monitoring, and Evaluation in 5 African countries, building skills and ecosystems that foster a culture of accountability and learning. Dr. Ndamobisi holds a PhD in Sociology and Demography, where he completed it in the University of Bourgogne in France. Our second speaker today will be Sharon Oladiji. She is a child protection specialist in the UNICEF Nigeria country office. Ms. Oladiji contributed immensely to the development and launch of the report that we will be hearing about today, the impact evaluation of the UNICEF-supported birth registration program in Nigeria from 2012 to 2016. Ms. Oladiji validated the theory of change to fit the evaluation plan and provided data, trends, and analyses on registration, both in numbers, coverage, performance, and percentages. Ms. Dakota Gruner is the Executive Director of ID 2020 and an advisory board member of Dharma. ID 2020 is a public-private partnership whose objective is to accelerate technology in order to ensure that every person on the planet has a unique digital identity as part of their basic human rights. Ms. Gruner also worked as an executive officer and consultant at the Gavi Vaccine Alliance. Joining us today will be our colleague from the government of Nigeria, Dr. Zakari Lawal. He is the Director of National Monitoring and Monitoring and Evaluation in the Ministry of Budget and National Planning in Abuja, Nigeria. Dr. Lawal holds a PhD in agricultural economics. So thank you everyone for joining. And before we get to the presentations, we'd like to show you just a short video that we've produced about the birth registration program and the impact evaluation in Nigeria. So Celeste, over to you with the video.
Because birth registration the purpose of this evaluation was to demonstrate the success of birth registration program implemented in Nigeria to provide strategic recommendations for future initiatives in this area. This evaluation is very important because birth registration is a primary child right. And in a big, large country like Nigeria, with 36 states and 200 million inhabitants, civil registration offers opportunity to children and youth to get access to social service. Key findings from the evaluation revealed that the birth registration program was very successful. The number of children that are registered increased drastically from 3 million annually in 2012 to 5 million annually in 2016, bringing the total number of children that benefited of birth registration certificate to 19 million. In addition, the program resulted to non-intended impact of a reduction of child right violation in Nigeria, like the issue of child marriage and female genital cutting. This evaluation serves as an important influential advocacy tool. Government, partner, state government, and local authority use lesson learned and recommendation and make shift in strategy, expand partnership, and increase public financing that enables scaling up of birth registration 2019 and 2020 in Nigeria.
Over to you, Robert.
Thank you, Celeste. Dear all, good morning or good afternoon from Nigeria. We are very, excited to have this opportunity of sharing knowledge about birth registration in Nigeria. And yes. So this is me, Robert, from UNICEF Nigeria. And we thank you very much that you take your time to participate to this great opportunity to share, knowledge about how the evidence can be used to improve program, partnership, and policy for birth registration that have been done in Nigeria. So I'm going to share the PowerPoint. We have some few slides that will show up those key findings and policy implication that happen in Nigeria. So we are very grateful to this good partnership between UNICEF Evaluation Office in New York, Senti Research Center, and then the global partnership with ID 2020 to be together and share this knowledge. And we're very encouraged in Nigeria, all staff in Nigeria, by this good practice of, you know, um, giving award to best research and evaluation to country office, which is very encouraging for all practitioners of evaluation and decision maker in Nigeria. Thank you very much. The starting question is that why to do an evaluation of birth registration program in Nigeria? As you see from the video, Nigeria is the largest, country in Africa with high demographic, size and the large economy in Africa. So it means that, birth registration has a very critical role to play, and there is also political implication of birth registration for all, election and governance. Secondly, I would like to highlight the point that birth registration is a primary child right that ensure human dignity and opens the door for access to social service to children and youth. So it's a key condition to ensure child rights in Nigeria and in the world. So the purpose of this evaluation was to demonstrate the evidence of success of birth registration program that was implemented in Nigeria by government, the National Population Council, at federal level and state level, with support from UNICEF and European Union Commission, and to provide strategic recommendation for future initiative and influence the policy and strategy to scale up this great initiative. What are the methods that have been used as it is an impact evaluation? This evidence generation was developed on theory-based approach, which start with assessing the assumption of the program theory of change of birth registration program, and also an evaluability assessment has been done. What was the scope that are covered? It assess the relevance, effectiveness, efficiency, impact, and we add other criteria of gender equality and sustainability. To generate sound evidence about impact, the quasi-experimental design was applied to this impact evaluation, making comparison between states that benefit of intensive intervention and the states that are not exposed to intensive program of birth registration. So both mixed method, quantitative survey, household survey, and qualitative method have been applied. New technology has been used for data collection analysis. And one of the comparative advantage of birth registration program in Nigeria is that they apply digital systems. Rapid SMS system has been developed and very functional for this program. Multivariate analysis and triangulation of information have been done for this evaluation. So what are the key findings? I summarize key point from the finding. What work is that it is a very good model of multi-sector integrated programming which led to the expected outcome level achieved. My colleague Sharon will come in about the best practice of integration of birth registration into health intervention, into education and wash intervention. So this integrated model make possible that expected outcome have been achieved in Nigeria. Regarding effectiveness, there is an increase over 100% of the number of children that benefited of birth registration nationwide from 3 million in 2012 to 11 million in 2016. At the end, during the 5 years, we have at least 19 million children who benefit of birth registration. Regarding efficiency, there is a very good value for money because the unit cost for registering the registration of children of a child is 0.27 US dollar. The program also has contributed to some impact that were not expected regarding the reduction of child right violation. What didn't work is that the program wasn't able to achieve the target of impact. The program was very ambitious. To initially, they plan to achieve 20% point of increase of birth registration rate, but at the end, during the evaluation, evidence show up that there is only an increase of 5.4 in birth registration rate.
Robert, I'm sorry. May I interrupt you for a second? We don't see your slides. We're wondering if you're able to share the charts with us. I'm sorry to interrupt you.
Sorry. Okay, let me go back.
It's a share screen button on the bottom of the window. It's between the chat and the raise hand.
I'm sorry.
No, it's no problem. And colleagues, those joining us can type in your answer in the Q&A section, which is the button next to the slide. There we go. Great. Thank you so much.
Okay.
And sorry for interrupting.
Okay.
Yes. Thank you.
Okay. May I go back or let me move to yes. So yes. So I already talked about the context, the national context of Nigeria, a very large country in Africa, the biggest economy and demographic size. Young people are the large part of the population, but we have only 48% of children that have access to birth registration. There is an issue of poverty, and human capital is still challenging with high level of infant mortality and maternal mortality, and at least 10 million children are out of school. So doing an evaluation of birth registration was very important because this is an issue of human dignity, the primary child right that will facilitate access of children to social service. So I already talked about method and innovation that we apply the quasi-experimental design to assess the impact. And then we cover the global evaluation criteria plus 2 additional criteria that we add regarding gender equality and sustainability. For this evaluation, the theory-based approach was applied. A new technology innovation has been used. So this is a key finding that I was presenting. What work is that the good, integrated model of birth registration program in place in Nigeria make possible that expected outcome have been achieved. So there is an increase of number of children who benefited of birth registration from 3 million annually at the starting of the program to 11 million in 96. In total, 19 million children benefit of birth registration. There is a value for money. The unit cost of birth registration is very low, is affordable, 0.27 US dollar per child. And there's a program also contributed to achieve non-expected, impact regarding the reduction of child right violation. What didn't work is that the program was very ambitious regarding the impact. The target that was set at an increase of 20 percent point of birth registration rate wasn't achieved because only 5.4 of increase in birth registration rate was achieved. Taking into consideration the demographic size of the country. And there is an issue of inequity that is still pending for access to birth registration. Family that are the non-poor family have a high rate of birth registration in comparison to poor family. So those are the key, quantitative findings regarding effectiveness and the shortfall regarding the impact of target. This evaluation was a very important policy advocacy tool because based on the evidence, the finding, there have been a national dissemination forum that involve all high-level political stakeholders, all population commissioner coming from all states of Nigeria, all development partners, and there have been a very strategic, debate around lesson learned and recommendation, and it was used to, make a shift in strategy and to expand partnership to increase public financing for scaling birth registration service delivery in Nigeria. So what are the next step? What is being done now is about the implementation of a recommendation. Government and UNICEF partners have been able to develop a more evidence-based policy advocacy and strategy vis-a-vis, government partner and development partner in all states. The strengthening and reshaping of the program. To implement now a digital strategy. My colleague Sharon will talk about this very soon. And how to expand the integrated multi-sector model of birth registration in Nigeria. From UNICEF side also, we take into consideration all our recommendations into our annual work plan in 2019, 2020, 21, and also until 2022. Government and UNICEF have been able to establish a very good partnership with World Bank, National Bureau of Statistics, regarding civil registration program for better rights and better governance in Nigeria. So we thank you very much. It's a good practice. The purpose is that every child has a right to be somebody. Without a birth registration, you don't have any right, you don't exist. So thank you very much for listening to us and to participate to discussion. Thank you.
Thank you very much, Robert. And this is a very interesting from a methodological standpoint, and for sure on the results of and cost effectiveness of this program. Let's turn it over now to your colleague, Child Protection Specialist in Nigeria, Sharon Oladiji. Over to you, Sharon.
Thank you, Robert. Can you stop sharing so that I can share my screen?
Yes.
It's right on top of you. Yeah. Okay.
It's okay?
Yes.
Okay.
Yeah, here I am. My name is Sharon. My name is Sharon Oladiji, and I'll be presenting, I'll be making the next presentation on the topic is evidence, practice, and innovations on birth registration in Nigeria. I'm from the child protection section, and the impact evaluation of the UNICEF-supported birth registration programming, I'll be looking at the program component. For the evaluation report to be concluded, and starting with the kind of evidence that we had, the evaluators had to go through some 420 documents to come up with the report, which gives credence to the effectiveness of the program. And part of the evidence brought out, you know, the beneficiaries, the participants that we engaged with, which are mothers, parents, caregivers, and children and babies themselves. The evidence produced also enabled and showed that the program applied multiple strategies, which demonstrated results for the improved efficiency. On the issue of innovation, interoperability, and the convergent programming, I'll talk more about that in a minute. Part of the evidence we try to show through the evaluation report is the relevance of the program. And we see the program aligning with the national priorities and coherent with strategies of government in Nigeria relating to birth registration. You know, there was no dichotomy in bringing forth the program. It's aligned perfectly with the priorities of government. Robert talked about the number of children in the impact, and he gave evidence also of how we came about the 19 million children. And he said that it's one of the things that didn't work because of the population. And I want to agree with him because we were aiming at 20 points, and these 19 million children were just the 5 or 6 points in Nigeria. And when we unpack this 19 million, it's all about 20 countries of the Western Central Africa, the under one population. So it's a huge result that is being demonstrated through that evaluation and the efforts of government and UNICEF to birth registration in Nigeria. For sustainability, part of the evidence that was presented also was this is not just a project, a kind of project that you just do project and you forget it. No, the kind of effort that was put in brings out the sustainability over the years. When you look at the integration with it, especially the innovative technology that I'll talk about in the next slide. What are the practices, or what are the good practices? We had the systematic approach to identify, first and foremost, the bottlenecks informs this program. The bottleneck analysis was done around that 2012, and it basically looked at what are the bottlenecks, you know, that impacts negatively universal coverage of birth registration in Nigeria. And the report looked at 9 basic bottlenecks that are divided into 5 compartments of the workforce, You know, what do we have in the workforce? As a workforce, a bottleneck, the legal frameworks, because we have, what was the legal frameworks like? Because we have two parallel systems where there's a commission that's supposed to register children, where the Constitution also, you know, allow the local government to register. The Bottleneck Analysis brought out issues on workforce, but on monitoring, on the supply and demand side, and also talked about the equitable service delivery. So with that bottleneck analysis in that year, we used the recommendation of the bottleneck analysis to drive birth registration programming in Nigeria within the time of the evaluation. What is a good practice that we also embarked on is convergent programming. UNICEF, child protection, we find that the birth registration cannot be a standalone program. So we had to work and leverage on the strength in health, on education, in a WASH program, because all these are working in the communities. We also work with the C4D, you know, the communication for development, and even a bit on social policy. So the convergent programming resulted in good success that helped maximize resource and the intended result, including that impact. Now, another good practice that we engaged in was the public sector resources and capacities through the interoperability with health, you know, enable the program to enhance coverage. The public sector is linked with the innovative use of ICT. We have mobile providers supporting birth registration to allow birth registrars to use their telephone to send in birth registration reports. We have a rapid SMS dashboard that is web-based, that is open source, that anybody can access to see the result and just the number of children that were registered per month, per year, per local government, per registration center. So the rapid SMS dashboard is so important because it's being used as a monitoring tool, as a reporting tool, as an advocacy tool, and as a management tool. It also helps with accountability of the attitude of the registrars, so that an average registrar can be tracked if that registrar did not post anything. So the chief of office can sit in Abuja and be able to see what in that remotest health center, what is being done. These are the good practices that support the kind of results we have, because birth registrars were made to sit up to report at least the number of children that were registered per time. Now, the accountability is one of the key successes of the program that we believe can merit replicability. What else did we do as a good practice? We find that the media, an alliance with the media, is a fantastic tool to deal with ignorance and weak knowledge base of general society in Nigeria. So we engaged with the media to promote public awareness on the importance of birth registration, and it's a targeted intervention in states, and every state where we have used the media to promote birth registration messages, we see that state doing very well in terms of the coverage, in terms of demand, because it dealt with knowledge base of people who does not know the importance of registering the birth or the importance of having a birth certificate. This is one of the good practices that we engaged in. Strengthening coverage focused primarily on delivering birth registration at health facilities. So that when we look at the rapid SMS dashboard, you can see at a glance the precise health facility where birth registration is taking place or is not taking place, is far away, is urban, is rural, is low, is high, and others. So we focus primarily on the health centers, especially in rural communities. Now, birth registration incidentally in Nigeria happens at the health centers. Unfortunately, about 50-something% of babies are also born at home and do not access the healthcare facilities. So within the communities, and part of the convergence in programming, we have to work with the health sector, volunteer community mobilizers who are doing the polio eradication and WASH program. These work in the communities, and these were capacitated to support birth registration for children who are not accessing or who cannot get to the health centers. So they became a perfect bridge to support improved birth registration processes. Finally, on the good practices, because of time, the enabling environment and the government leading roles impacted at the federal and at the centralized level. So we have the full support of the management of the National Population Commission, from the chairman to the federal commissioner, to the state directors, to the community, to the local government. So this is one of the good practices, because we kept on bridging the gap. In fact, there was no gap between government, working together with government, which is a plus for the results we achieved. Now, looking ahead, based on the evaluation report that you notice, I said that these three I's kept on coming: the innovation, the interoperability, and the incentives. When we quickly look at this is what we are doing about the digitization of birth registration, starting with working with the Identity Management Commission to be issuing at least unique identification number. Let me repeat, this is looking ahead. This is where we are going. This is what we're conceptualizing at this moment. This is what we're looking to make possible at this time, meaning that when a child at birth, like we can see, as that unique identity number, that number will keep that child from infancy to primary school, to secondary school, to when he's old enough to have bank account, to university, and above when he wants to work. The digitization process and the unique identification number. Also, we can track the number of school enrollment, children dropping out, children, being kept in school. We can track the social services that is being done to those children, and so on and so forth. But we're looking ahead to get to do this kind of innovation through the unique identity, through working with identity management, and through leveraging on resources from development partners. Now, we look at this. This is another part of looking ahead, when we're looking at interoperability. No, I missed that. Sorry, I missed the slide. Oh no.
Sharon, I'm sorry to interrupt you, but we're going to have to conclude soon, so we have time for Ms. Gruner's presentation. Okay. and a lot of questions that are very good. Thank you.
Okay, I'll do 1 minute and I'm out, and I'm done. Well, this speaks for itself. We're seeing, this is looking ahead. We're seeing at how young people will contribute to universal birth registration. I'm short of time, I may not be able to say this, but simply put, we're trying to see young people that can support through digitalization, automation process, through the private sector, notification during immunization, and ensure the children are registered at birth. Basically, this is what is here. Then for the, I'm a bit, okay, another looking ahead is how to solidly work with the health sector to ensure every baby that is born, every baby that is immunized is issued birth certificate. That is what this whole lot is a flow chart of what we plan to do. This is my last slide. So we will continue to demonstrate results in this area of digitalization, automation, IDG management. We will work on improving our delivery services, generating demand through the media, and then look at useful learning for the stakeholders, while we make sure birth registration remains pivotal to child well-being in Nigeria. We'll work with a more proactive approach taken to improve registration of newborn, of those left out, those marginalized, in rural communities, by tailoring strategies and interventions to reach out to this group. We'll reach out to development partners, including World Bank, by multilateral and bilateral donors and civil society organizations to leverage resources for improved universal coverage. Thank you. I'm done.
Thank you very much, Sharon. You can see that both presentations really generated and spurred a vibrant Q&A section. If Sharon and Robert would like, they can answer live by just going into the Q&A, clicking answer live to make some comments. Otherwise, we'll save them as well during the Q&A. Our last speaker is Ms. Dakota Gruner from ID 2020. Over to you, Dakota.
Thank you. Let me just take 1 second to get my screen share going. Can you see my screen?
Yes.
Great. So thank you so much for inviting me to join today's webinar, and I've learned so much already from the other panelists. In my remarks, I wanted to pick up from Sharon's comments regarding the 3 I's: innovation, interoperability, and incentives. I didn't intend this, but I think that's the perfect frame for what I plan to speak about, which is focused on discussing pathways to expanded birth registration and specifically focusing on the link between immunization and digital ID. And I want to use a project that we're involved in Bangladesh as a case study and as a model that I believe could be replicated and scaled with huge potential impact. I hardly need to tell this group, and particularly after the last 2 presentations, that the ability to prove one's identity is a fundamental and universal human right. And yet, over 1 billion people worldwide, including nearly 1/4 of all children, are unable to prove their identity through any recognized means. The inability to prove identity has profoundly harmful implications because a verifiable identity answers not just who are you, but also what rights do you have. And so without a legal identity, individuals risk being not unable to access basic services like education and health. Perhaps to widen the lens a little bit, I think that furthermore, kind of around the world, it's becoming obvious that existing digital ID systems are problematic. That many of the solutions that we've used to prove who we are, particularly in online transactions like usernames and passwords, don't protect privacy, are cumbersome, and often aren't portable. And while I commend and applaud the focus that we've seen in the last number of years on closing the ID gap, there's a concern that this emphasis on ensuring that everyone has an ID could accelerate programs that pay little heed to privacy. And so where we start, in kind of our work at ID 2020 on digital identity is thinking through, how do we simultaneously close this identity gap, but ensure that every necessary protection is put in place around digital identity systems in order to ensure privacy, to give individuals control over their own data, and ultimately to ensure that digital ID programs and the solutions used are of use to individuals and to organizations. I wanted to use a project that we're involved in Bangladesh as a particular frame for the conversation today, because I think it illustrates both a potential opportunity and sort of a potential model that could be replicated elsewhere. So this is very much a healthcare related presentation, but bear with me. So, in healthcare, lack of ID makes it difficult to ensure continuity of care, to track services received, and to identify and reach out to individuals in need of care. And for children in particular, lack of identity or lack of birth registration makes it nearly impossible to ensure that every child receives the full course of life-saving vaccines. These challenges are felt quite acutely in Bangladesh, where 80% of Bangladeshi children do not have a birth certificate at age 5. These children are functionally excluded and sort of somewhat invisible to the system. And while they may be able to get by in their local communities without recognized identification, there is significant seasonal migration in Bangladesh, and the country anticipates significant climate-related displacement in coming decades, which necessitates a means by which these individuals can prove their identity, even when far from home. The implications of this for Bangladesh's healthcare system are also significant. While 95% of Bangladeshi children receive the basic life-saving vaccines, there's often a significant drop-off throughout the vaccine course, which leaves many children exposed to vaccine-preventable diseases. Bangladesh also has a uniquely fragmented healthcare system, which compounds this situation, and care is often delivered through a mix of NGOs, private sector providers, traditional providers, and the government, which can result in disrupted or duplicative care. This is a slightly controversial perspective, but I think is the fundamental hypothesis that drives our work linking immunization and digital ID, and which we aim to evaluate in the project in Bangladesh. In recent years, there's been significant focus on building and investing in foundational ID systems, including birth registries, and a very, very understandable desire to shift away from siloed, what are considered functional ID systems. And this diagram, I think, shows that idea of a very linear flow from identification provided by a birth certificate, upon which is layered a functional ID system to manage authorization. But I think that there's an opportunity to increase birth registration coverage by rethinking that order of issuance and meeting children and mothers or caregivers where they are. Emerging technologies and their increasing adoption, including inexpensive smartphones, high-reach wireless data networks, and advances in biometrics, are making it possible to imagine sort of digital ID that's inexpensive, accessible, and safe. But digital ID systems remain difficult to expand in many countries where birth registration rates are lowest. And to address this challenge, our hypothesis was that you could start with immunization, and that vaccine records could serve as a surrogate. So where birth records could not be attained early in life, you could start with health cards and then use that as an entree to then expand birth registration. So this is sort of the foundational idea behind the project. The most common vital registration globally, we believe, is the child health card, and that particularly in low-income countries, where birth registration rates are low, vaccine coverage rates are often significantly higher, making immunization a unique entry point to develop, deploy, and scale a good digital ID system, one that protects privacy, is widely recognized, and which is interoperable, allowing eventually access to services from early childhood. Bangladesh is, I think, a particularly good kind of candidate for this model. It has achieved high immunization coverage with 90% of the population receiving the DTP3 vaccine. And so the intent behind this project is, using a digital child health ID as a digital immunization record, which supports immunization coverage and equity goals, but also using that as an entry point then for birth registration, streamlining registration, and ultimately using it as a way to ensure that kids have both a birth certificate and access to a lifetime of social economic opportunity. That said, so the idea is to use immunization as an entry point. But to sort of fully realize this opportunity, I think requires going beyond an expansion of current initiatives. We need to build on the success of sort of multiple current programs working to digitize CRVS and health systems. We need to explore the potential of biometrics to facilitate authentication and record persistence, and develop and use a means for technical interoperability that addresses fragmented systems in a user-centric and privacy-protecting manner. On that last point, to date, most digital ID efforts and sort of digital registration efforts have been quite institutionally oriented, with the idea being that you focus on providing a registry for a single use case, and that has resulted in a patchwork of non-interoperable and siloed systems. And here I kind of want to zoom out for a little moment, that there is a rising groundswell globally of support for user-centric digital ID, which would be recognized across institutional and international borders and over time. And so with this approach, individuals would be able to collect verifiable digital credentials, including their immunization records, vocational training certificates, proof of residency, and then selectively share these records to apply for a job, to access financial services, or participate as a citizen or voter. So going back again to Sharon's point around interoperability and incentives, this model is one of interoperability that we believe actually leads to significant incentives. The intention of this program is to implement user-centric digital ID, to go beyond sort of a point-to-point integration between the National Civil Registry, health systems, and electronic immunization registries, in order to facilitate continuity of care and user management of their own data. So the program will implement a digital ID system consistent with ID 2020's technical requirements for good digital ID, and one that is interoperable with systems that are being deployed, particularly right now in the context of COVID-19 and use of digital records for proof of immunization for COVID-19. We believe that this emphasis on interoperability is absolutely key. The program also uses, builds on sort of operational processes and operational successes. So giving community health workers digital tools to help with that enrollment process. The Caliganj Model, which is sort of quickly shown in this slide here, was a program implemented in Bangladesh that demonstrated significant improvements in birth registration rates between 2015 and 2017, simply by giving community health workers kind of a role as they went door to door for immunization, service delivery in assisting with the birth registration processes. And so by digitizing this and by giving those community health workers the tools to assist and to issue a digital vaccine certificate, we aim to build on the success of that project. Finally, there's one additional thing that I'd like to just highlight about the project that I think is quite interesting. There's currently no proven solution for biometric identification of young children. Fingerprints morph throughout childhood, and the small size and the sort of squishiness of infant fingers complicates taking high sensitivity prints. And so most governments as such set a minimum age for reliable fingerprints, well beyond childhood and time of immunization. And other biometric modalities have also proven difficult. Recently, a number of solutions have been developed with the potential to unlock child biometrics, but none of them have had sufficient longitudinal data to establish things like the necessary frequency for re-enrollment. And there's been sort of no study done that compares the viability and cost effectiveness of these solutions. And so in addition to some of the objectives of the project that I've described already, one of our aims and what we've built into the initiative is a research project that is longitudinal in order to assess the viability of child biometrics. And while they are currently only hypothetical, we do believe that this research study could unlock a global public good. With that, thank you so much.
Thank you, Dakota. Very interesting. A lot of alignment with the birth registration program in Nigeria, and obviously there would be some opportunities for this. Let me now turn it over to Dr. Zakari Lawal from the Ministry of Nigeria Budget and Planning Office for his comments and reactions to what he's heard today. Over to you, Dr. Lawal.
Yeah, thank you very much. And good afternoon all. Well, no doubt, the three speakers, has really done justice to the issue that they presented. Dr. Robert, in Dr. Robert's presentation, he highlighted the robust methodology that is used, in evaluating bus registration in the study, of the bus registration in Nigeria, and he came out, on with issues highlighting, what worked and what has not, which is really very innovative. And the study has also used, a very robust methodology, which is really excellent. And for me to say that all the speakers, have really addressed the issue of why bus registration, is very critical. We know, and in line, with the SDG motto, objective, and goal, which is leaving no one behind. Issue of registration is really very critical, especially, to the most vulnerable, part of the population, which are the children. So the speakers have really highlighted, why vital registration is very critical, especially, for the government and of Bangladesh and Nigeria, are countries that have a similar, population trajectory, especially, for Nigeria, which is projected to be, the third most populous, country in by the year 2030. So this study, is really very important, and I believe, it will add a lot of value, to the planning, by the respective governments, especially as they address, the issues of children. And as we are all aware, human capital, is the background for any development processes. And without adopting, innovative strategies to see how those, how the children, are empowered, with adequate human capital, there may be challenges for development. So I think these studies are really very critical and very important. So to the basket of knowledge, especially, going forward in terms of addressing, the needs of children in the respective country that they address. I will just stop here and say that the papers have really been very productive and will definitely add value. And thank you very much, for giving me the opportunity to really review these three presentations. They are excellent, and they are really in line and are robust, in terms of providing facts and figures, that will enhance planning and development. Thank you very much. Thank you.
Thank you, Dr. Lawal, and thank you to the panelists for excellent presentations. It is becoming clear that quasi-experimental designs that have more rigorous elements will provide much more substantial findings and evidence that could help plan better. Let me go to the question and answer, and thank you, panelists, for helping to answer some of these the questions. It's been a vibrant discussion, and let me start with just asking perhaps Sharon, I know you've answered some of these questions, but let me combine some of them. What was really done differently from the past? Where should the future investments be? And let's talk a little bit about some of the things that went wrong in this model. We heard a lot of great synergies in the integration, but if you could just talk about where should we go in the future with birth registration and any of the bumps that you incurred along the way in these 4 years of evaluation. Over to you, Sharon.
Thank you. Basically, where we are going is the interoperability, the innovation, and the interoperability with health and other partners, and then the innovation, the digitalization. These are the incentives. These are the areas we're moving from the evolution time. And if you ask me, these are some of the things that the evaluation report wrote that didn't work. For example, the number that we all spoke about, they went to reach 20 points, we reached 6 points, 6 points is 19%. Then the evaluation talked about working at the community, that we didn't work sufficiently with the community, with the traditional rulers, and with some, we didn't push too much, even with that media. We did, like I said, the media work was targeted. It was targeted intervention. So these are the things we're going to. And then the rapid SMS, as you said, is a monitoring tool. It's not a it's not digitalization. So this is what we're looking at post the evaluation report. How do we automate? How do we get more people, involved at the local level, at the community level, at the religious traditional institution? How do we work better with health? Because there's a lot of resources in health that we can leverage on, because that's where children are born. And then how do we automate the service to link up with the identity management? Because one weakness we had in the evaluation was that there was a strategic plan that we're supposed to automate. We're supposed to work with the Identity Management Commission, but because the process of MEMPOPSI was not digitalized, there was a disconnect. So with the government looking ahead in this year and years to come to digitalize, to automate, to do better on interoperability, and to work more with the media and the traditional sector, I think we can make better improvement. I don't know whether I answered the question. Over.
No, thank you very much. I think you have, and I think there's a lot of good responses in the written section as well. Let me combine a couple of questions that weren't yet answered live. Our colleague from Madagascar has raised a very interesting element, which is about behaviors. As we know, technology can solve a lot of problems, but it can't convince people to register births and other vital statistics, which have proven to be more challenging than setting up an automated birth registration process. What do you think, what kinds of activities have you done to work on the behavioral aspect of this? And perhaps if Dr. Lawal is still on the line, what role does the government have in helping to convince people to register their newborns? Perhaps first Dr. Lawal, and then back to Sharon. Over.
Hello.
Yes, we hear you, Dr. Lawal.
Yeah. So you are asking about what role the government can you please?
Yeah, the question is, what role can the government have in convincing civil society to register and take advantage of digital birth registrations, automated birth registration processes?
Well, the government, has really an important role, as an enabler, because it provides, the enabling environment to ensure that all stakeholders, can synergize collective effort, to address birth registration. So I believe, the government, can serve as a good enabler, especially, of all the key stakeholders, around this particular problem, including the civil societies. So government, can really do that, providing an enabling environment to ensure that the objective is achieved. Yes, thank you.
Sharon or Robert, do you have any thoughts on this behavioral element?
Do I go on, or Robert, do you want to come in, or I should just go on? Okay. For the behavior, like I said, the media, we have worked with the media. We're going to still work with the media to change behavior. We have the evidence to show that when we work with the media, attitudes are changed, behaviors are changed. We work with the Communication for Development section. We're working with the National Orientation Agency. These are the NOA is a government institution that works at the community level to change mindset, to change behavior of the civil society. So this we will do, we will do more as we move into the new year. We find that when people hear that this works, when people hear that they need to do something in the media, we have some good responses, especially for birth registration. I don't know if that helps.
Thank you very much. Go ahead, Robert, please.
Yeah, no, I would like to add that one of the explanation of, little impact was, about, the lack of involvement of traditional and religious leader at community level to address the issue of social norm and individual, behavior to increase, interest for birth registration and to pay for, the registration of birth. So this is an area, as Sharon said, government and UNICEF will invest more using communication for development strategy to remove those, behavior and social norm barrier at community and family level. Thank you.
Thank you, Robert. We're just a few minutes over time. Let me just give the last question, and thank you very much for all these questions. I wish we had more time to facilitate a more detailed dive into birth registration. For Dakota, what opportunities do you see for a private partnership with such programs like this that are supported so positively by the government of Nigeria and many governments, actually?
Fantastic, excellent question. I mean, I think that the project that I was speaking about in Bangladesh is very much meant to be a model. That we think that this is, a model, particularly through Gavi's support, that could be replicated elsewhere, and that, I think so much of what has been discussed about the birth registration program in Nigeria reflects a very sort of similar starting position, and so. We would love not only to, to sort of discuss with the government of Nigeria sort of a similar program, but to ensure that any of the learnings that we gather from the work in Bangladesh, can inform processes and policy in Nigeria and elsewhere.
Thank you very much. Yes, I mean, I think there's a lot of opportunity here, actually. The world is going digital, and digital will be here to stay. So this is just a natural, inevitable migration, and birth registration is among the most basic of human rights. I'd like to thank all the panelists and the discussant for joining us today. And to leave you with just some resources, if you would like more detailed explanation of the evaluation, especially on the methodology, the quasi-experimental approach that was being employed, please go to our website. It's in the chat. Celeste has put it in the chat with the recording of this webinar and other resources that might be useful for other people to take note of. But with that, I'd like to thank all the participants for attending. I know this is hard to always find time, but we thank you very much for your active participation, and thank you to the panelists. Have a good afternoon, a good day, and a good evening.
Thank you.
Thank you very much. Well appreciated. Bye-bye.
Bye-bye.
Well done.
Thank you.
Thank you, everyone.
Bye-bye.
Thank you very much. Well appreciated. Thank you.